Yes, here you have it. Back in the Veterans Hospital. I came in Friday night. May 14th. I went to the clinic, the Veterans Clinic. I was on my primary care. She called the ambulance and had me sent to the hospital. And what's happening is that I had my kidney surgery and there was some complications with that. But the first doctor in the emergency room was okay. The midnight doctor, she was oh man, forget about it. Young student, you could smell the baby formula on her breath. Arrogant. She seemed to despise men. And she was cool. And all the testing came back. She didn't go deeper into the testing to find out what was wrong. She wanted to send me home. At the last minute, she says, well, I don't know what's wrong with you, but I'm going to put you in observation and send you to observation to see what they can figure out. So I came up to a medical observation, which is in the Veterans Hospital on the 6th floor, 6K. And I had this wonderful doctor. His name was Dr. Melendez. Came over, was on the spot, right on the money. And today I'm feeling 70% better. But these young doctors, they have no empathy. And I personally don't feel that a young doctor who just graduated, who's still learning and is going through what they call the internship, should be treating veterans. The same with young social workers. They cannot associate with us veterans, especially combat veterans and the older veterans. It's like having your great-grandchildren trying to tell you what to do, and they're getting it all wrong. Now, I don't know how many veterans out there watch this, but these younger doctors, they just get you in and get you out. The same as with my surgery. I had my surgery a month ago, April 15th. And by the time I got home, I could not pass my stools or nothing. Can you imagine a whole month without trying to go to the bathroom to defecate, and at times throwing up your own bowels, and then you come and get a snotty winch doctor? But on the ward it was different. Very different. And then the doctor from Gastro who did my colonoscopy came up to see me, and he had made some recommendations also. So she did not call in these experts that she's supposed to call, like she is supposed to call. She didn't call in Gastro into the emergency room. She didn't call in urology or medicine. She just took it on herself to berate me. Oh. That same thing happened in Hospital Padilla. I went to Hospital Padilla. That's P-E-R-E-A on Diego Street in Mayagüez. And I told the doctor I had chest pains and I had just had kidney surgery. And I told him what I was allergic to. And he says, well, I got to test to see if you're allergic to it or not. I wouldn't let him do it. And, he seemed hell-bent on not treating me unless he could see if I was allergic to the medication. So I gave him my doctor's number at the Veterans Clinic. He was still adamant about it. And so he came with the needle, and he says, okay, we'll see if you're allergic to this here. And I said, okay, where's your precaution? There was no precaution. You know, no crash wagon, no nothing, you know. So I bopped him over the head with my crutches, and I signed out. I had my friend Lewis pick me up with his car and take me home. If I had the, he knew he was wrong, so that's why he didn't call the police. The eugenics in the medical field. Not in the United States. No way. Well, here you have it. I can see why there's a high rate of suicide with veterans. These doctors, young children, psychiatrists, psychologists, what do you want to call them? Doctors don't care. Social workers don't care. In the older days, I remember when all the people who worked in the hospital were veterans. Even those who cleaned the floor, took out the garbage. Now, what they did was they took the veterans out and they contracted the people to come and clean. So they put the veterans out of a job. What's your opinion about the veterans and the veteran affairs? You know, I'd like to know.